Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments and when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 120,132 confirmed cases of COVID-19 in Canada and 40,161 cases in Ontario. Chatham-Kent has 328 cases and Sarnia-Lambton has reported 327 cases. Michigan now has 87,960 cases, with 12,987 cases in Detroit. Today, we are reporting 2,393 cases of COVID-19 in our community, an increase of 14 cases from yesterday. 3 people are in the agri-farm sector, 3 are local healthcare workers, 1 is travel related to Michigan, 4 are in the community, and 3 are still being investigated. 131 of our cases are currently active and are being followed by our health unit. 2,191 people have now resolved, 112 people are self-isolating, and 7 people are in the hospital. 26% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39 years. 65% are male and 35% are female. Our community has lost 71 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. 2 retirement homes are currently experiencing a COVID outbreak. In addition, there are currently 10 workplace outbreaks. 5 are in the agriculture sector, 4 are in the manufacturing sector, and 1 is at a construction workplace. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain, if you're feeling confused or losing consciousness. Windsor-Essex has 2 COVID-19 assessment and testing centers, Erie Shores Healthcare in Leamington, and Windsor Regional Hospital Olette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test result. To check your results, please go to wechu.org and click View Your Results to access the online test result portal. If you are unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. Tomorrow, our region joins the rest of the province in Stage 3 of the reopening. In Stage 3, most businesses and public spaces are able to reopen. Activities that are still restricted and must remain closed are amusement parks and water parks, buffets, dancing, and restaurants and bars unless hired performers, overnight stays at camps, private karaoke rooms, contact sports, saunas, steam rooms, bathhouses, and oxygen bars, and table game at casino and gaming establishments. All other businesses can open, ensuring they continue to meet the health and safety guidelines and appropriately apply public health measures. As well, gathering limits will increase. Under Stage 3 restrictions, gatherings are increased from 10 persons to a maximum of 50 if indoors and 100% if outdoors. Residents and businesses should note that these limits do not apply to your social circle, and physical distancing must be maintained at all times. These numbers of 50 and 100 are maximums, not including at their place of work. For example, if the indoor space can accommodate 50 persons with appropriate physical distancing in place, the maximum for that space may be less than 50. Physical distancing continues to be one of the most strongest and most effective public health measures to limit the spread of COVID-19. Your social circle limit is still 10 persons. Social circles are those that you may come in close contact with, hugs and kisses, etc. Social circles limit the number of individuals that you are exposed to by limiting close contacts. Keeping and maintaining a small social circle is critical as we move into stage 3, as more individuals venture out. While this is definitely news to celebrate, it does not mean the pandemic is over. COVID-19 is still with us. Reopening safely means ensuring that we all continue to do our part. For businesses and workplaces, that means ensuring that they have policies and procedures in place to address all health and safety measures and guidelines, and these are strictly enforced and adhered to. For residents, this means ensuring that they keep physical distancing between themselves and others at all times. Physical distancing is 2 meters or 6 feet apart. As well, continue to practice good hand hygiene. Wash your hand regularly with soap and water or using alcohol-based hand sanitizers when soap and water is not available. Wearing a mask or face covering in commercial establishments when physical distancing cannot be maintained, it's an added layer of your protection. Stay home when you're sick and consult with your healthcare provider and getting tested when you have signs and symptoms of COVID-19. This and all other public health measures will keep us safe and our region moving forward. To learn more about stage 3, please visit our website, www.wechu.org. For more details, please follow specific restrictions and regulations under the provincial order. Visit Ontario's webpage for reopening at ontario.ca/page/reopening-ontario. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Any questions from AM 800?
Dr. I'm just looking for some clarification when it comes to the reopening plan. You mentioned indoor capacity 50 people. We had some restaurant owners reach out to us yesterday. Is that for restaurants as well? If a restaurant can fit, for example, just say 100 people and they socially distance properly, is their limit still 50 people inside a restaurant?
The overall indoor gathering limit is 50 people, and that's irrespective of the space. It can be less if there's not enough space available, but the maximum people indoor can be 50 people.
Sorry, I know you touched on it. Does that include their employees too?
No, that do not include their employee, but I'll have to double check on that. I don't know if my team can answer that, but I don't think that it includes their employees.
So it would be 50 residents plus their staff on top of that?
That is correct.
Thank you.
Any questions from Blackburn? Any questions from Blackburn? Any questions from Windsor Star?
Yes. Good morning, Doctor. I'm just wondering, in some of the places that are now opened up under stage 3, like gyms, is mask wearing required?
So for gyms, we have our specific guidance. Mask is not required when people are exercising in the gym. It is required in the common areas, and some of those details are still applicable, and some of those guidance are available on our website.
Okay, thank you.
Any questions from Kovid?
Yes, good morning, Doctor. Are the measures mandated by the health unit, or is this directive coming from the province?
All of these directives are from the province, and obviously our health unit have some additional measures such as masks in commercial establishments. But other than that, all of these measures in terms of restrictions, number of people, it's all coming straight from the province.
All right, and I know a lot of kids are itching to get back into contact sports. I mean, hey, people want to go to buffets and go dancing and all that stuff. So is there a time frame or a limit on how long they'll be restricted and not be able to do what they do?
Well, at least until we see a decline or an absence of COVID-19 in our community, and when we feel that it's no longer a concern, I think that will be the safest time. I know there's no timeline attached to it, but what we know is it just takes few people to spread it among many, and our region can easily go back to a place where we have more cases that exceed the thresholds, the ability for health system to respond, and we definitely don't want to go there. So I think we just have to use and learn and adapt to what we can do in this time around, and just continue to do our part for the sake of our community and also for our own well-being and our family.
Okay, thank you, sir.
Any questions for Windsorite?
Good morning, Dr. Ahmed. I was just wondering if the health unit has any plans to extend the mask rules to some of the businesses that are opening under stage 2 or stage 3. I'm sorry.
At this point, we haven't thought about any specific business establishments in particular, but we are constantly looking for data. We're constantly looking for any ongoing risk or new risk that we can identify. If we identify any new risk, we'll definitely act on it. But at this point, I don't have anything that we are considering at this time.
Okay, thank you.
Any questions from CBC?
Yes, good morning, Dr. Ahmed. Just wondering if anyone has come in to get tested because of the COVID alert app that people have been downloading on their phone.
The assessment centers may answer that question. We're not aware of anyone who came in as a part of that testing. And health unit, as you know, we do not test people. It's the assessment centers and the healthcare provider, and they may be able to answer that question.
Okay, just wanted to see if there was any sort of data, if it was effective in our community. Thanks.
No problem.
Any questions from Canadian Press?
Hi, Dr. Ahmed. I'm hoping to get an update on the testing efforts that are going on in the farm community. I know that you're saying that the testing is not really something that the health unit is overseeing, but I'm just wondering if you can describe your role on that at this point, and how many farms that you know of have been participating in this.
So from a public health perspective, obviously, we are supporting our health system partners who are basically taking this initiative through Ontario Health and other health system partners to expand testing opportunities and options for all these farm workers. To my understanding, we have tested completely 38 farms, but public health case and contact management continues, and we continue to get testing results and workers coming back positive. So that work is ongoing, and is still today, even as we are talking about, we reported 3 cases in the agri-farm sector, and we continue to do that, excuse me, every day. And so from a case and contact management, which is part of the symptomatic people, if they have any symptoms, their employers are sending them for testing and appropriate follow-up. So that is ongoing. It never stops. But as a broader testing strategy, we do have the team, and we do have a schedule that I'm aware of that the farms are signing up and getting those testing done.
So, Dr. Ahmed, it sounds like you've got 38 farms, which is still a far cry from the 160 or 70 that are in the region. How much uptake have you got? I mean, do you feel like there's good participation, and how many farms are still signing up?
Well, I think the farms are signing up as we speak, and the uptake is pretty good. And I don't want to assume that the farms that are not signing up, that they have active cases. So what I will be more concerned about, if we are not getting all these calls about these people who are maybe exhibiting symptoms and then going for testing. I do feel that as a broader overall strategy, I think it's more appropriate for all these farms to have a better handle on what's going on within their population. But I don't want to undermine the fact that the farms are still sending their people for testing, which is what we are recommending to any other workplaces as well. So if they have a symptomatic worker, they should send him or her for testing. And the same guidance applies to the farm workers as well, that if they have someone who is suspected of COVID, they need to be tested immediately. But as far as the asymptomatic surveillance testing is concerned, we do encourage them that they should take that proactive measures, and then they send their people for testing. It would give them a better indication of what's happening or who may have been infected, and maybe pick up some of the early infection if they're not so obvious or overtly symptomatic for the rest of the worker. So we do support them, but I feel that as long as we are getting all these cases, we're getting in touch with all these farms. I am not overly concerned, but I do want most farms to get tested and sign up for testing.
So, Dr. Ahmed, I don't want to misconstrue what you're saying. It sounds as if you are not necessarily concerned about testing every single worker, but only workers that are showing symptoms at this point?
No, what I'm saying is I definitely want workers that are showing symptoms that they should get tested for sure. There shouldn't be any doubt in that. What I am saying is when we're talking about these, you asked me about if I'm concerned if some of these farms are not coming forward for testing. I'll be more concerned that if they have symptoms and if they're not coming forward for testing. But I do encourage them, the rest who may feel based on their assessment that they may not have any symptomatic worker. And if they feel that for various reasons, we have heard from the employer that they are reluctant to send their workers because they feel that if their worker is going, they are now putting them or exposing them for COVID. Because right now in a contained environment, they feel that they are doing everything fine and they don't want to send those workers. So there are different reasons for that. And as much as I still want to encourage them to, yes, please go ahead and send those people for testing. But as far as the concern is about, I think I would be more focused on those symptomatic workers. And if they are getting tested, if they're not getting tested, that's when I will be concerned. If they're not getting reported to public health, that's when I'll get concerned.
Any questions from Blackburn?
Yes, sorry for hanging up on you last time. Yesterday we had 11 cases. We have 14 today. Dr. Ahmed, are you concerned that this could be the start of a new trend where we have more cases?
Well, I'm optimistic that some of these cases are in close contacts and some are travel related and some of them are healthcare workers. So I think if we know that where these sources are coming from, and it concerns me more when we don't have an identified source, which we attributed to community spread. And if those cases are increasing, that would be my concern. Even when in close contact we are talking about are travel related, we don't want to undermine the importance of following all those public health measures that we highlight every day. And people need to be mindful of that. But I think my main concern will be more on the cases that we cannot identify or link with any potential exposure sources. We are keeping a close eye on every case that we are getting, at least for the last couple of weeks, to make sure that we can, if there's any appropriate action that is needed, we can take those actions. So we'll continue to monitor all those data, all these numbers, and try to put strong control measures in place right from the beginning.
Now, both of the larger school boards, three now, the English Catholic, the Public School Board, and the French School Board have all released their plans. Each one says that elementary school students, JK to 8, will be in class 5 days a week. There seems to be, at least from what I'm reading in other media, a bit of a debate going on about just how big a carriers children can be. What is your opinion on that?
So we have been in contact with the school boards as well, and we're looking and reviewing their plans and providing our feedback on it. Our team is also working on looking at all those evidence details and provide more concrete guidance and recommendations to these school boards. So all of that work is happening, but I am aware of all these concerns and all these debate that's going on. And we want to make sure that we use the evidence-based approach and working with the school boards to have a plan that ensures the safety and well-being of our children.
if the science does tend to work out that children are bigger carriers than we thought, what would be your next step?
Well, I think we have to make sure that that we have all the appropriate control measures in place, and especially when we are talking about all our children and how they behave in the class, what their behavior is. It is important that we do everything to protect them, including the options of masking, including the options of cohorting, including the options of class sizes, what it does it look like. So all those options we are looking at all those evidences. We are working with the school boards, and we're also trying to apply all the available scientific evidence to support our recommendations.
Thank you.
Any further questions from AM 800?
I'm not sure if this is for Teresa or Dr. Ahmed. For the case that's travel related today to Michigan, do you have any details to that? Like, how is this person crossing the border? Are they going to Toronto and flying to Michigan, or are they crossing via the bridge or tunnel?
I don't have that information. I don't know, Teresa, if you have that information. Probably not.
All I know is that the person is non-healthcare related and did have travel to Michigan. So that's all I know.
Okay. And then Dr. Ahmed, one more question about stage 3. I know casinos can reopen in stage 3, but the 50-person inside limit is in place. Has Caesars reached out to you? Caesars Windsor reached out to you? And if so, do you have to approve a plan for Caesars if they decide to reopen?
They did reach out to us, and our team is working with them to go through their plan. The limit still applies, and also in addition, the table games, as I mentioned, they will not be allowed. So the plan is currently being reviewed right now, and we will provide them with our guidance soon.
Okay, thank you. Have a good day.
Thank you.
Any further questions from Windsor Star?
No, thank you.
CTV?
Yes, Dr. Ahmed, just to pick up on the education topic, just wondering, what will the health unit do if kids are tested positive for COVID when school begins in September? Like, will you inform the parents alone, or will the school community be informed as well?
So we'll take our typical outbreak plan that we have for, let's say, childcare facilities and other workplaces. So we'll do a combination of identifying the source and declaring an outbreak as needed. So by generally speaking, when we are talking about outbreak, it has to be 2 or more cases that are epi-linked, which is like, for example, 2 students in one class, they both exhibit symptoms, and if there is reasonable expectation that maybe the transmission happened at in the school. So we will then take those as an outbreak measure. But if, let's say, if a single person or if a single student, single child is identified as a case, then we'll try to treat it as a possibility that where this case was acquired, whether it was acquired at their home, outside, or at the school. So based on that determination, we'll take appropriate approach, informing maybe just the close contacts or just the people who are in this cohort, or if it requires much bigger investigation or discussion, that would happen. So it would be hard for me to say what would be the approach, but the range of options exist, including all the way from maybe just taking this individual or this child as an isolated case versus all the way up to declaring an outbreak and doing further investigation.
All right, because I'm just picturing what could happen, because if you have, a couple of cases in a classroom, then you have a teacher or an EA that happens to come in contact with that class and moves along to, other classes within the school. I don't know. I'm just picturing a big shutdown here. Could that even happen?
Well, given the plan, so what we are trying to encourage is that when we're talking about cohorting, so students and teacher, they should all form a cohort. So the movement of teachers from one class to another, we obviously want to restrict that, just for the same reason that if something happens or if there is any spread happens, it is contained in one classroom rather than a teacher going from one class which could have been infected and to 10 different classes and then potentially expose other people as well. So I think that's the rationale and idea behind cohorting and ensuring that all these children are sticking together and are not coming in contact with the rest of the cohort to minimize any potential spread in the school.
Okay, thanks for that. Appreciate it. Have a good day.
Thank you.
Any further questions from Windsorite?
About 2 weeks ago, the health unit advised the public about the Chuck's Roadhouse, the potential for infection since an employee had worked there. Did anything result from that? Were there any community cases among customers or any spread that happened from that situation?
Good question. I don't believe that we have linked any case to that at this point. And as we have identified in the past that at the time when we disclosed that the exposure risk was low, and hoping that because now you made a good reminder that it's 2 weeks now. And if you haven't seen any cases that are linked to the exposure at Chuck, so that means that's a good sign. And maybe there was no potential transmission happened there.
That's good news. Thanks.
Any further questions from CBC?
No, thank you.
Canadian Press?
Just a quick one, Dr. Ahmed, about I'm just curious how many agri-food workers at this point have active cases of COVID-19.
Teresa, do you have that number handy? I think it was close to 79 or 80 workers that were active. I don't know if you have that information handy, or we can maybe send it to you.
I'll just confirm that currently there are 63 active farm workers.
Even less, 63.
63?
63.
Okay, thank you.
Any further questions from Blackburn?
Just one quick one, Teresa. I missed the total number of active cases right now. Could you repeat that for me?
The total number of active cases is 2,393.
No, that's the total caseload. How many cases are active?
131 of our cases are currently active.
Thank you.
Okay, thank you, everyone.
Thank you.
Bye.